Hello and welcome to NCTV episode 116, which is all about sacroiliac joint dysfunction. Now when someone comes to me into clinic and says, it feels like my hip, they usually point to somewhere at the back towards the pelvis. But more often than not, they're not talking about their actual hip joint at all. Today we'll be demystifying a common and often overlooked source of pain, sacroiliac joint dysfunction. If you've never heard of it, you're not alone, but once you know what it is, what to look out for, suddenly it makes a lot more sense. So what is the sacroiliac joint anyway? You've actually got two sacroiliac joints, or SI joints for short, and they're based at the base of the spine where the sacrum bone, the triangular shaped bone, meets the iliac bones. They're built for stability, not movement, unlike the shoulder or hip, but they do allow a small amount of motion, just a few millimeters in fact, which helps to absorb shock and transfer weight between your upper body and your legs. When these joints stop working properly, either too much or too little, they become irritated, leading to discomfort and dysfunction. So what causes SI joint dysfunction? SI joint issues can be from either excessive movement, often more flexible people, or during pregnancy, or restricted movements, often due to stiffness, muscle imbalances, or inflammation. Common causes include prolonged sitting or standing, especially on one leg or side, uneven weight distribution when carrying a child, bag or load, repetitive one-sided movements, falls or direct trauma from the pelvis to the pelvis or lower back, pregnancy-related ligament laxity, and a leg length discrepancy or foot mechanics which can alter your gait. It's also worth noting that stress and reduced core control or glute strength can play a role. Now on to what symptoms to look out for. The tricky thing about SI joint dysfunction is that it often mimics other conditions. People might assume that it's a hip problem, sciatica, or even pulled glute or hamstring muscles, but that's not always the case. Here are some of the common signs to look out for. A dull nagging ache in one side of the lower back or buttock, pain when getting up from a chair, discomfort rolling in bed or standing on one leg, a feeling of jammed or stuck movement in the pelvis, and occasionally pain radiating down one leg, not quite sciatica, but easy to confuse. And it's usually one-sided, often feels deep, and it's hard to pinpoint. And here's a little fact for you, the SI joints are so stable because they're held together by the strong ligaments. As a result, the joints only move a matter of millimeters, like so, but that's enough to cause a real mischief if they're not working properly. So what can you do about it? Great question. The great news is that it is very treatable through manual therapy. Osteopathy, for example, can help by assessing pelvic alignment and identifying whether a joint is moving too much or not enough. Using gentle manual techniques to restore balance and ease by improving movement and reducing pain. Addressing the imbalances in the glutes, hip flexors and lower back, offering exercises to support the joints and reduce reoccurrence, and advising on posture, movement patterns and day-to-day habits. There are some things that you can do at home too, so here are some self-help tips you can do. Avoid crossing your legs or leaning to one side when sitting. Try simple core glute exercises like bridges and pelvic tilts. Use heat or cold packs depending on what feels best and what relieves you most. Stay active with gentle movement and avoid bed rest, as this usually makes it worse. If standing for long periods, shift your weight regularly. These little changes can make a surprisingly big difference. When considering the outlook, with the right treatment and self-care, most people recover well from sacroiliac joint dysfunction. And if you're finding yourself saying, I think it's my hip, but nothing quite adds up, it might just be a SI joint. And now you know what to do about it. So that's it for today's bite-sized bit to help your health flourish, and I'll see you again next time. Bye for now.